In the wake of the Supreme Court overturning Roe v. Wade, multiple states have dedicated additional funds and resources to facilities known as crisis pregnancy centers to dissuade women from getting abortions. Texas, by far, has invested the most, but there's questions about how that money is being spent. CBS News and ProPublica looked into it in a joint investigation. Here's Caitlin Huey-Burns with the findings.
Every day, nurse Megan Wheeler drives across the Texas Brazos Valley, caring for new young mothers.
Good morning, how are you?
Like 16-year-old Ava Bradley and her 1-year-old son, Mateo.
Thank you.
They connected through the Nurse Family Partnership, a free program that pairs nurses with low-income first-time moms. Nurses like Wheeler cover just about everything, from the latest ear infection.
Any fever for either of you, or just?
No.
To making sure mom is okay, too.
How's school been this week?
Pretty good. I'm a little behind.
It's a model that's shown to improve maternal and infant health outcomes, says the program's nursing practice manager, Angela Montez.
Nurses have been able to intervene and be able to save our women and children from dying.
Because they're there.
Because they're there.
But in a state where teen pregnancy is on the rise, the program is struggling to meet demand.
We're able to serve maybe a quarter of the referrals.
So last year, the program asked the Texas legislature for an extra $19 million. They got just $2.2 million. Meanwhile, the state program called Alternatives to Abortion, which includes funding for crisis pregnancy centers, got so much money last year, it had $14 million left over for future use. It's also referring thousands to the nursing program that helped Bradley, but it does not fund it. For years, Democratic State Representative Donna Howard has questioned how Alternatives to Abortion operates.
I don't know of any other program that the state administers that is treated in the same way, not one.
Alternatives to Abortion grantees offers services like counseling, classes, and material goods like diapers and formula. But more than 40% of the services provided since 2021 were categorized as educational materials, a vague designation.
What is that? It's a material.
There's some speculation here, but I'm thinking pamphlets, one-pagers,
so
that sort of thing.
So a pamphlet counts as a service?
Is an educational material as a service, yes.
Yeah.
A CBS News and ProPublica investigation uncovered a payment model that allows the program's largest contractor, Texas Pregnancy Care Network, to charge the state $14 for handing out a pamphlet as part of its services.
This amendment would add $25 million in supplemental funding.
Republican State Representative Jeff Leach is one of the program's most ardent supporters.
This program is really meant to provide the full weight and support and resources of the state government, not just before pregnancy, but after pregnancy as well.
But there have been issues.
The money was meant to help pregnant women and parents with young children.
A San Antonio nonprofit was kicked out of Alternatives to Abortion after a local news station reported it was using program funds on vacations, a motorcycle, and a smoke shop. The nonprofit did not respond to our questions.
If taxpayer dollars aren't being spent appropriately, then we will hold those responsible accountable.
Are you concerned that this program is ripe for fraud?
No, I'm not. We should be giving them more resources, not less.
Invoices we obtained show the program's second largest contractor, Human Coalition, spent roughly $2 million of its state funding every year since 2019 on marketing costs. That's 10 times more than what it spent on direct client assistance, like diapers.
$2 million for marketing. Wow, that is astounding. Seems extremely inappropriate.
Representative Leach said the marketing costs were necessary to create awareness.
Ooh, that one's big, though.
Holly McDaniel runs the Austin Diaper Bank, a nonprofit that distributes diapers to places like this food pantry, where every week a stream of cars lines up for free baby supplies. Diaper banks sought state funding last year, but got nothing.
You're welcome.
There are families out there and really good organizations out there doing good work and serving those families. I would love to give them diapers, but diapers don't grow on trees.
A spokesperson for the state said it takes stewardship of taxpayer dollars very seriously. And Texas Pregnancy Care Network told us its services are responsive to clients' needs. Also of note, last September, Alternatives to Abortion got a new name, It's now called Thriving Texas Families. Caitlin Huey-Burns, CBS News, Washington.
ProPublica reporter Cassandra Jaramillo is one of the partners on that report. She joins us now for more. So the way you figure out if money is being spent adequately is through the oversight process. How is it that this spending is happening and not receiving oversight to see if it's effective?
It's a great question, John. Well, what we learned through our reporting is that the state has pretty much outsourced oversight to Texas Pregnancy Care Network. And through our reporting, we found that it has a unique payment model in which its subcontractors get set fees for its services. And in some cases, these nonprofits are making such amounts of reimbursements that they're able to buy land or size up their assets.
And on this question of educational materials, so if the crisis pregnancy centers are now shifting to help with mothers now that Texas is restrictive on abortion post-Roe, how do education materials have anything to do with the care of newborns?
Right. So when we were able to identify the most amount of services that Texas Pregnancy Care Network subcontractors do, the thing that stood out the most were those educational materials. And we tried as much as we could visiting several pregnancy centers across the state to figure out what exactly are in these materials. We know that they can be one-pagers or pamphlets, and it's distributing these materials that can actually generate a $14 payment. Unfortunately, the invoices for these subcontractors are very vague, and even the state of Texas does not know exactly how much is being spent on educational materials versus essential items like diapers or formula.
And is all the state funding coming from taxpayer dollars?
That's a really great question. So there are a lot of crisis pregnancy centers across the state and the country. As it relates to this specific program that we investigated, it is all taxpayer money. And in some cases, some of these nonprofits actually rely more than like 90% of their revenues on the money that they're able to get reimbursed through Texas Pregnancy Care Network. In our investigation, we bring readers to the McAllen Pregnancy Center, which is an interesting example of a center that's gotten millions of dollars, I think upwards of $3 million. And yet during that time of the last 3 years that they've been reimbursed that amount, they've been able to add $2.1 million to its assets.
Cassandra Jaramillo with ProPublica, thank you so much.
Thank you, John.